if we take a look, you can see he's got his anterior 6 teeth. The right side is all intact. The left side is all broken off at the gum line. So, in order to get a purchase point on this side, what are we going to do?
C.
Make a C, right? First thing is what? As a pre-step, sever the PDL and maybe get some movement, right? So we're going to just confirm that he is numb. If you feel anything more than a pressure, you just raise this hand, okay? All right, here we go. So remember, I go in on a 10 or 15 degree angle, and you can see the gum is pretty loose here, but you can see that these are decayed quite a bit at the gum line, okay? So let's go in and just make sure everything is separate here. I'm just doing it with this. You can also go with like a curette. So a curette is like this. And then yesterday we were talking about the Orban knife, so I'll show you what that looks like. And then what you can do is always just keep suctioning that to keep it clean, please. This is what the Orban knife looks like. It sort of looks like a Hollenbeck. And the way this goes in is just sort of like this. Okay, so these are the 3 different things you can do. Like I said, as I get older and older, less patience. So now we're just going to go right to the pre-step to the wedge. I'm putting it on a 10, 15 degree angle. Okay, and then I'm just going to rotate. Little pressure here, okay? Here we go. I'm just twisting and holding. You can, if you look at the film, you can see the movement there. See, as a pre-step, I'm doing already quite a bit. What I'll do is start on the mesial of all of these on this side, and then I'll go to the distal of those, and then as I come back, it'll be the opposite. So we'll go ahead and do that again. Little pressure. Again, the mesial. And then same here. Good. And now we're going to get on the root tips. Same here. And again, that's the beauty of this. If you look at this instrument, it's very thin. There's a little curve to it, but very minimal. And this allows us to get in there very well. You would not be able to do that with a luxator or an elevator. Okay? Let's go ahead and clean that, please. Let me just do this one. Okay, so let's just go over here on the canine. And here's some pressure. And you can see this is pretty decayed, okay? I'm always going to attempt to take a tooth out without having to use the burr if I can. So everybody sees how I'm using this as a pre-step. It's already moving, quite honestly. All right, so let's go. We're going to start with the easiest one first, right? Go ahead and keep that suction there, please. We're going to put that on solid tooth structure. Make sure that my beak is parallel with the long axis of the tooth. See how it was off? Make sure it's parallel with the long axis of the tooth, and get that tooth out. Can somebody get me a 150? Bill, can you get me a 150, please? And you can see that's out. All right, let's go to the next one. So we'll go to our other lateral. Same thing, we're going to line this up. Make sure the long axis is parallel with the tooth. And same thing, a little pressure here, sir. I went 10 to 15 degrees. We'll do the other 5. I can see the movement already. Remember, you can push up, twist, and you'll see when you twist, it'll come to the path of least resistance, so you can actually see the curvature of that root. Can you just clean the palate too, please? Okay, let's go to the central now. So notice, I'm trying to get whatever I can without using the burr first, and if something breaks off, then I'll go ahead and use the burr. Just clean this. I'm dentist and half movie director, so I want to make sure that field is was cleaned for first. All right, so watch. When I go in, I put the bumper in first. It retracts the lip. I'm confirming the angle of this beak is parallel with the long axis of the tooth. So if we take a look, it's somewhere right about there. So now I'm just going to grip. I'm not squeezing hard. If you look at my hands, that's not on the film. But if you look at my hands, I'm barely holding on to that. And now we're going to go ahead and leverage. We're going to let our patient know he'll feel a little pressure. Little pressure here. And I'm at 10 to 15 degrees. There's some resistance. So I'm just going to hold it for about 20 seconds. And then I'll go the additional 5. Okay? There you go. Did everyone see it just gave? So now I'm going to go ahead and get my 150. Where did I put it? Here we go. And you're going to see we're going to grab onto this. I'm not going to go buccal lingual. I'm going to press apical and then do my twist. And you can see it's a good size, and periodontally, these are pretty good. It just he's got rampant decay up there. How you doing, sir? Okay? Perfect. All right, let's see if we can get the physics forceps onto this. So let's see, we have number 9. So I can already see that number 9, I really can't get to it. Let's see if we can just do this. See, I just moved the gum out of the way with this before I start reflecting them totally. I'm going to position the beak. Good. And this is where you can ask your assistant, am I on? Is my long axis parallel with the long axis of the tooth? How's that look? Good. All right, so we're going to do the same thing. 10 to 15 degrees. And then all of a sudden it's going to build up. I do the extra 5. And it just gave. Again, it's all by feel. So now I get a good grab of the tooth. We press apical. Whoop, that just decayed. So if that happens, we're just going to grab it a little higher up. We're going to grab it a little higher up, push in. See, it just keeps twisting. So I'm going to show you what I like to do sometimes. I'm going to deliver it with the physics forceps. Dr. Golden showed me this trick. You ready? Here we go. So if you look, I did even more because it loosened up. And I just, so I can reflect that, or maybe I'll just grab it mesial distal and get it out. Okay? All right, we saved the 2 best for last, the canine. Here we go. This is where people make a mistake and they don't orient the forceps on the long axis. So very easily I could go like this because it looks like it's correct from the front. But in reality, it needs to go right about there. Now, you can't see it in the camera, but the facial area of this tooth right at the CEJ is severely decayed. So my assistant knows this may fracture off. She's going to be prepared with her suction. Just in case, I'm going to put a little catcher's mitt there. Okay? And we're going to go and attempt to get that off. So a little pressure. We're going to hold it there. That's the 10 to 15 degrees. See, I'm off angle, so now I'm going to correct it. And a little bit more. Little pressure. These are long roots, sir. Did everybody see how it just gave it with that extra 5 degree? I don't go past the 5 degree. So we're going to grab it and do our little twisty. And you can see it, how long that root really is. Okay? Okay, we got one more tooth left to go. So let's see if we can just get the gum out of the way. There we go. And you can see a little bit of movement already on that one. The beauty when teeth are infected is if it's got a periapical lesion around it, what does that mean? It's looser, right? It's going to be easier to get out. So we're just going to position that right there. Follow the long axis of the tooth. And you saw how quick that came out. Again, it's severely decayed, so it's loose. Just not much to hold on to. All right, let's see if we can roll that out. There we go. All right, we're going to look at our x-rays to confirm everything is out. I do want to check number 10 because that seemed like it was really short. Go ahead and suction in all those, please. Do we have some sterile water, please, in a syringe? Let's take a look. Good, so we're going to go in each one of those and cure it out. So if you remember, we go in and out to the facial. Yeah, to me it feels like number 10 may still be in there. I'm going to take a look. Thank you. You can just put the cup there. Okay, we're going to irrigate. Good. Just a little bit of air here. And let's look at our x-ray. And to me it looks like there may still be a little piece in there. So we're going to grab our handpiece. So in your office you would quickly just take an x-ray of it, but I just want you to look. Look, this goes down, this goes down. There's a little bit of a catch there, right here on number 10. This is good, it's right here. See how it doesn't go as deep? That means there's a root there. Okay, go ahead. I will need the root pick, someone. Just a little vibration, sir. Okay, a little bit of water. Good. Suction here. Thank you. A little force here. I see it moving. I think you just got it. Let me see. Let go. Yep, looks like we got it. Let's just confirm. There's an apical portion still there. This is an endo-treated one. Ideally, you want water coming out of your handpiece when you're doing that. Here's that piece. Suction it. There you go. Good. All right, we'll get our rongeurs and smooth the bone a little. So this is just the inner dental bone. Just a little pop here, sir. Here's the scissors. Suction. Suction. So we're not removing all the keratinized tissue, but this way we can get it to come back together very nicely. Suction. There you go. Good. Okay, one more irrigation. You can close on that Strasser. One sec, she's bringing it. Okay, go. Thank you. Open. Good. So you see by cutting that tissue, it came together nicely. We've got one more little piece to cut. Okay, so let's use some BioViva. So if we're going to go ahead and put the osteogen, what I like to do is pinch it first and then cut, because when it's round, it's hard to cut. So we're going to put these two in the central areas, okay? Right there. And right there. I'm going to have you hold this just like this for me. And then you can use this to just flat for me, okay? All right, in the meantime, I'm going to go ahead and get the BioViva. And since the laterals are small, just so we move quickly, I'm going to put these in the canine area. This is the BioViva. It comes in 2 in a blister. And so what you want to do is roll it. Okay, and then put that in. So we're going to go ahead right in here. Good, blot it. And then put the other piece. Good, and already you can see the tissue is getting controlled here. If we had another BioViva, I would just put it in there. We don't, but that's okay. So now we can suture real quick. So remember, we talked about it. You're going to go from the inside out. That's too long to work with. I don't like them too long. I'm going to have you cut that right there. No, here. Higher, higher. That's good. Thank you. Okay. So now we're going to pass that through. That was just a suture. See, if it's too long, it's not easy to handle. Okay, so now we'll just go. Remember, what did we say yesterday? We work from the inside out. So we're going to go ahead and do that. Little poke here. So what I'm doing is sort of a continuous suture here, okay? Go ahead and blot that, please. Doing okay, sir? Almost done. Look, see how I pressed the osteogen out of the way? So apical to that, and then bring this through. And now bring this in. And sometimes it's dry. There we go. Good. Go ahead and blot it, but blot it with a little force, please. Yeah, you won't hurt anything if you press it. If you start to see that the chromic gut's getting like that, then I have my assistant just wet it a little bit. That way it doesn't get stuck like that. Any questions? Okay, so you don't have to watch me suture anymore. We're just going to wrap up. Sir, that went really good. Do you want them to continue with the lower? Yes? Okay. So I'm going to need 2 docs in here to numb him up on the bottom and get his anterior, I believe there's 6 on the bottom as well, that need to come out, okay? All right, start going into your cubicles. Look at the charts. Introduce yourself and get started.